How soon could I get a second Asian blepharoplasty or revision? I got my first blepharoplasty 2 weeks ago, but my eyelid crease is already smaller than what I would prefer. I don't have too much swelling, but I know that the size of my crease will probably decrease a little bit more since the surgery was so recent. How soon could I get a revision to increase the height? What are the complications with having a second surgery over the first incision?
Thank you for your question. You submitted a question without any photos, but you're stating that you had Asian eyelid surgery done about 2 weeks prior, and you feel that already you feel that the crease is lower than you would like, and that you have minimal swelling, and you want to know about the option of when is a safe time to have revision, and you want to know are there complications related to going through the original incision. Well, I can certainly assist you with this question in more broad terms. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. The oculofacial surgery background comes from having first specialized in eye surgery before doing very advanced training in cosmetic and reconstructive surgery of the eyelids through the American Society of Ophthalmic Plastic Surgery. So you can imagine I do a lot of work with eyelids, and I've been in practice for over 20 years in Manhattan and Long Island. And Asian eyelid surgery has been a focus of my practice both in primary surgery and revision work. So to understand this type of situation, I think it's important to first for you to reflect back on how you came to the conclusion on what type of surgery to have when you had your consultation with your doctor. To understand in broad strokes about how Asian eyelid surgery is divided, it's divided into incisional and non-incisional, and then within those two types of surgery, we make decisions about doing either a parallel crease or a nasally tapered crease, and essentially with the occasional patient who may want an epicanthoplasty. So that being said, I'll tell you how I approach this type of procedure in my practice. It's my philosophy, and it's worked out well for me and the people who come to me, that my goal is to create an eyelid crease as if nature had already created a crease there. It's well understood that 50% of Asians have a crease and 50% don't. But even within that population of having a crease, there is going to be variety and variations based on skin thickness, the genetics of characteristics passed through the family, the amount of fullness, how deep set the eyes are. And so what I usually conclude, and I do a simple test by using just a Q-tip or a special eyelid crease device to just create the crease as if you already had it, and it gives me an idea of what kind of zone I'm able to work within. I've learned over time, and I've seen from patients who've come through referral, that even though you may want to have a certain anatomy, a lot of times the body just doesn't allow that type of anatomy to be created. And so when you write in your question that the crease is lower than you had wanted, understand that there's still a relatively narrow zone in which an Asian eyelid crease is typically placed. Now, just for sake of reference, the typical crease for an Asian eyelid is anywhere from like 6 to 8 millimeters compared to a non-Asian eyelid, which is closer to 10 millimeters. And that's at the central height of the eyelid. So when you think about it, if you feel like your crease is too low, how low can it really be? Is it more likely that you're dealing with maybe some swelling above the crease that may make the crease look like it's too low? It also, from the procedure that, or at least the statement that you had an incision, and you're concerned about having another incision, it may be that what you're dealing with is more overlap of skin than you want, and not so much the height of the crease. As a general rule of thumb, the backbone of the eyelid, called the tarsus, usually is consistent with around the same height as the eyelid crease. And so it's likely that your surgeon placed the crease at that height, but in determining how much skin to remove, may have been more conservative to create a more natural appearance. It's very important to understand that as opposed to non-Asian eyelid surgery, you always have to leave a certain amount of skin in order for the skin to fold over and look natural. If you take away a lot of skin over aggressively, then you don't have any overlap, and then it doesn't look as natural. So that being understood, yes, you have time to see how things settle out. Especially incisional eyelid surgery, you can have swelling that is above the crease that can be causing some of that overlap to look more pronounced. In general, I prefer to do revisions after there's been adequate time for swelling to resolve, as well as for wound healing to the level where there's some predictability and that we're not dealing with potentially swollen tissue. So generally, eyelid revision surgery should be done, whether it's Asian or non-Asian, when it comes to, as long as there's no urgent issue. Urgent issue meaning anything that compromises eye functions or is a problem in terms of abnormal scarring, or something that's more urgent as opposed to the cosmetic aspect. You can do it as early as 3 months, but it's more common to do it around 6 months. A lot of my patients before and after pictures are taken at 6 months, because I know at that point, even though wound healing can go on for a year, with the exception of some people who may have a low-grade swelling, I usually see the 6-month point as being closer to the final place where it's going to be settled. Now, it might be a straightforward thing in terms of the, quote, risk of making another incision. It might just require that you need a little bit more skin removed, and then you'll have a better result. There are also situations where I'll actually do a non-incisional approach to create a more defined crease, and that can sometimes be done at a higher point. So which means that you may have an option to do this procedure without opening the incision again. Now, with all that being said, I think it's very important you speak to your doctor. It's clear that I'm sure you had done your research and you were confident in the doctor you chose, and therefore I am certain that the doctor who did this is familiar with this concern about the height of the crease and will likely have the familiarity to do some type of have a game plan for you in terms of potential revision. But I'm also certain that the doctor will want to give it appropriate time in order to do a revision, if appropriate, in a way that's predictable. So I hope that was helpful. I wish you the best of luck, and thank you for your question.